LET and RBE. What does LET stand for? Linear energy transfer. It measures the rate at which energy is deposited as a charged particle travels through matter. What does RBE stand for? Relative biologic effectiveness. It describes the effect of LET. It measures the biologic effectiveness of radiation having different LETs. Factors that influence RBE are the radiation type, cell or tissue type, dose rate. LET and RBE are directly related. OER, though, depends on LET, and it's inversely proportional. Here is the comparison of RBE versus LET. Stochastic and deterministic effects. Non-deterministic is also known as stochastic. It is non-threshold. Even small exposures could carry some risk. An example would be radiation-induced cancer and genetic effects. Non-stochastic, which is also known as deterministic, has a threshold, and the doses below which an effect is not observed. An example would be cataracts, arrhythmia, fibrosis, and hematopoietic damage. This graph represents a linear quadratic non-threshold. This graph represents a nonlinear threshold. This graph represents linear non-threshold. And here we see the comparisons between different types of lines. So the line A would be a linear non-threshold, line B would be nonlinear non-threshold, line C would be a linear threshold, and D would be non-threshold nonlinear. This was an added slide. Undifferentiated precursor or stem cells are other names for what? Immature cells. What is considered to be the most radiosensitive part of the cell? The nucleus. Chromosome-produced radiation damage can be analyzed during which portion of the cell cycle? Metaphase. LET is a measure of the energy transferred to material as an ionizing particle travels through it. This measure is used to intensify the effects of ionizing radiation on biological specimens. Acute effects of total body radiation. The effects are radiation sickness, hematopoietic syndrome, gastrointestinal syndrome, and central nervous system syndrome. The response stages. There are 4 response stages. Response stages: prodromal, latent, manifest, recovery, or death. In the prodromal stage, initial stage where the patient experiences nausea, vomiting, and diarrhea. The latent phase is the period of no apparent sign or symptom. The manifest is the reoccurrence of the symptoms. There's a graph showing that, how it occurs time-wise. Hematopoietic syndrome, which is also known as bone marrow syndrome. It occurs between 100 to 1,000 rads. Prodromal occurs within a few hours after exposure. Symptoms include nausea and vomiting. The latent phase occurs from a few days up to 3 weeks after exposure. A person may look okay, but bone marrow stem cells are dying inside. The manifest stage is reduction of blood count, occurs 3 to 5 weeks after exposure. Symptoms include depression of blood cell counts, leading to anemia and infection. Gastrointestinal syndrome. The dose range is 1,000 to 10,000 rads. The prodromal phase occurs within hours after exposure. Symptoms include nausea, vomiting, cramps, and diarrhea. The latent phase occurs until the 5th day. Manifest phase is the onset of nausea, vomiting, diarrhea, and also fever. Occurs from the 5th to the 10th days. In humans, death occurs within 3 to 10 days without medical support and 14 days with medical support. Central nervous system syndrome. Over 5,000 rads for the dose to occur. Prodromal phase. Depending on dose, this can last from a few minutes to a few hours. Symptoms include nervousness, convulsion, nausea, and vomiting. The latent phase may last several hours. The manifest phase is 5 to 6 hours after exposure. Symptoms include diarrhea, convulsions, coma, and death. Keep in mind, with doses of 5,000 rads or more, you will get 3 syndromes. You will get all 3 syndromes. This is the radiation effects on the skin based on the dose. Questions added. The lethal dose required to kill 50% of the populations in 30 days is the definition of LD 5030. For acute radiation syndrome in 100 to 1,000 rad range, death is mostly the result of damage to the hemopoietic system. In the latent stage, the person appears to be symptom-free. The shrinking of tissues or organs due to radiation is formed atrophy. Long-term effects of radiation. There are somatic and genetic. The somatic appear in exposed person. They're divided into 2 classes based on the rate of the dose received. Prompt somatic effects and delayed somatic effects. The prompt somatic effects occurs soon after an acute dose, typically 50 rads or greater, to the whole body in a short period of time. An example would be a temporary hair loss which occurs about 3 weeks after the dose of 400 rads to the scalp. The delayed somatic effects occurs years after radiation doses are received. An example of that would be an increased potential for the development of cancer and cataracts. Genetic. Explain Hermann Muller's experiment and state what the important findings were. So Hermann Muller experiment exposed fruit flies to varying doses of X-rays to observe genetic defects. When cells are irradiated, it does not create any unusual mutations, but it does increase the likeliness of mutations occurring. Majority of mutations were recessive. What were some radiation incidents that allowed to learn more about the effects of radiation on genes? The atomic bomb survivors, and offspring data. Define the following. Genetically significant dose. The GSD is the average calculated from gonadal dose received by entire population, used to evaluate the genetic influence of low doses to the whole population. The doubling dose. The dose of radiation required for generation to double the spontaneous mutation rate. Spontaneous mutation rate The dose for humans is 50 to 250 rads per each generation. Questions added in the slides. What dose-response curve is utilized for radiation protection guidelines when estimating the overall cancer risk from diagnostic and occupational exposure? Linear, non-threshold. What is the appropriate latent period for radiation-induced leukemia? About 4 to 7 years. Osteosarcoma follows what dose-response relationship? Linear, quadratic. Relative tissue and organ sensitivity. Explain the following studies and state importance findings of each. The law of Bergoni and Triboneau. In exposed rodent testicles to X-rays, the higher the metabolic activity of the cell, the more radiosensitive it is. The greater the proliferation and growth rate for the tissues, the greater the radiosensitivity. Ansef and Wittenberger, they discovered all cells possess the same sensitivity to radiation exposure. Rapidly dividing non-segmented cells, non-specified cells, such as skin cells, are more radiosensitive than non-dividing specialized cells, such as neurons. List properties of a cell that are highly radiosensitive. Cells that have high division rate, cells that have high metabolic rate, cells that are non-specialized type, cells that are well nourished. Immature, non-specialized cells with a great growth rate, younger tissues and organs. So radiosensitive or radioresistant. Skin cells, gonads, muscles, cells, and hair follicles. So radioresistant cells are bone cells, liver cells, kidney cells, cartilage, muscle, and nervous tissue. Radiosensitive cells are germinal cells, which are gonads, lymphoid tissues, basal cells, which are skin cells, hemopoietic tissues, epithelium of the GI tract. Those are all radiosensitive cells. List cell types that have low radiosensitivity. So highly radioresistant would be nerve cells, muscle cells, and chondrocytes. Intermediate radiosensitivity would be osteoblasts, endothelial cells, fibroblasts, and spermatids. High radiosensitivity with low radioresistance is spermatogonia, lymphocytes, stem cells, intestinal mucosal cells, and erythroblasts. Organ sensitivity. Highly radiosensitive organs are bone marrow tissues, ovaries, and intestines. Fairly high radiosensitivity is skin and other organs with epithelial cell lining. Includes cornea, esophagus, rectum, bladder, and ureters. Moderate radiosensitivity would be your stomach. Fairly low radiosensitivity is salivary glands, respiratory organs, kidneys, liver, pancreas, and thyroid. Low radiosensitivity would be the muscle, brain, and spinal cord. Questions added to the PowerPoint. The law of Bergoni and Triboneau states that the radiosensitivity of the cells is directly proportional to their reproductive activity and inversely proportional to the degree of differentiation, which is true. These last two statements are false, which those cells with a low metabolic rate are radiosensitive. False. Cells are more sensitive during meiosis. False. Which of the following is a measure of ionization or error created by X and gamma radiation? That would be Rankine. Who discovered the X-rays in 1895? Rankine. According to target theory, what is considered to be the critical organ in the cell? DNA. How does oxygen affect cell radiosensitivity? It increases it. Of the stages of mitosis, which is the most radiosensitive? That would be metaphase. The effects of radiation on the embryo or fetus. The fetus undergoes 3 stages of development: pre-implantation, major organogenesis, and the fetal stage. Each stage varies at the time of exposure in relation to the radiosensitivity of the tissue. What radionuclide crosses the placental barrier? That would be I-131. Basic concepts of radiation protection. Units of radiation exposure, principles of time, distance and shielding, personal protection equipment, personal monitoring devices, ALARA, and release of patients. The units of radiation exposure. We have Rankine, Rad, Rem, and SI units. Rankine. Rankine is a unit of radiation quantity or exposure. The amount of charged liberated ionizing radiation per unit mass of air. It is the measure of ionization of air that is created by X-ray and gamma ray below 3 megavolt, MeV. The SI unit state the conversion factor. The conversion factor is 1 coulomb per kilogram is equal to I can't actually see that. 3,875 Rankine. Rad. Rad stands for radiation absorbed dose. The definition is unit of absorbed dose. It is the energy that is absorbed in matter from any type of ionizing radiation. The conversion factor is 1 gray equals 100 rads. Rem. Rem is the unit of dose equivalent or occupational exposure. It represents the amount of radiation received by personnel. Approximately the same biological effectiveness as 1 rad of X-ray. The SI unit, state the conversion factor, 1 sievert is equal to 100 rems. Principles of time, distance, and shielding. Reduce the time spent near radiation source. Increase the distance between the radiation source and the individual to be protected. Use a shielding material to attenuate the radiation from the source. Inverse square law. The formula for inverse square law is right there. State the definition of inverse square law. Doubling distance reduces your exposure to a quarter of the original amount. We know why this is important. PPEs. What material is most commonly used as a shield and why? Lead. It has a high atomic number. It ensures that most scattered photons are absorbed. How is the effectiveness of a shield evaluated? It's evaluated by the half-value layer. The half-value layer of lead thickness that will reduce the intensity of radiation to 50%. When wearing lead, where should the whole body badge be worn and why? When wearing a lead apron, the personnel monitor should be worn at the collar level outside of the apron, measured the lens dose. Film badges. They contain photographic films with various film Filters, where amount of darkening on film indicates the amount of radiation absorbed. Filters are made of lead, copper, aluminum, plastic to decipher energy range, the radiation badge. They are effective in measuring from 10 rems to several hundred rems. The advantages are simple to use, cheap, readily processed, and a permanent record. The disadvantages: they're not reusable, the low limit sensitivity, susceptible in heat, humidity, and light leaks. TLD is the thermoluminescent dosimeter. They contain lithium fluoride crystals. The badge emits lights proportional to the amount of radiation absorbed when heated to be evaluated. The advantages are small, sealed in Teflon to minimize chance of damage, low exposure limit. The accuracy is within 5%, can be worn for 3 months, and reusable. Disadvantages are not a permanent record, and they're more expensive. The ring badge is properly worn on the forefinger of the dominant hand with the crystal facing palms of hand. OSL stands for Optically Stimulated Luminescence Dosimeter. It contains aluminum oxide to detect radiation exposure. The badge is evaluated by a laser is used to evaluate the badge. The advantages are they're sensitive to 1 millirem and not affected by environmental factors. They're done bi-monthly. They have a readout. The energy range is 5 kV to 40 MeV. Can be reanalyzed multiple times, and the accuracy is within 15%. The disadvantages are they are the most expensive. A pocket dosimeter. A pocket ionization chamber used when immediate exposure readings are required. The advantages are immediate readings, sensitive up to 200 milliroentgens, and can be used to record individual readings. The disadvantages are does not provide permanent legal record. Shock can cause false high readings, and expensive and require careful handling for accurate readings. ALARA, what does it stand for? As low as reasonably achievable. The NRC regulations 10 CFR Part 20 requires every licensee to develop, document, and implement a radiation protection program with the scope and extent of licensed activities, and to use the extent practical procedures and engineering controls based upon sound radiation protection principles to achieve occupational doses and doses to members of the public that are ALARA. How often is ALARA program supposed to be reviewed? An actual ALARA program needs to be implemented. The state checks this when they come to inspect in order to verify that the facility is compliant with reviewing annually and the ALARA program at each respective facility. They are to be done annually. Release of patients. In regards to therapy patients, what is the level at which patients' exposures need to be in order to be allowed back in public? It is determined that no individual in contact with the patient will receive more than 0.5 rems. If any person is likely to receive more than blank from the patient, then the patient must be given written instructions on how to minimize exposure to others. If any person is likely to receive more than 0.1 rem from the patient, then the patient must be given written instructions on how to minimize exposure to others. On an outpatient having a therapy procedures, what are the directions instructed to him or her? So they're pretty much told, just stay away from other people and don't use any of the same stuff as other people. Can two people undergoing the same therapeutic procedure be kept within the same room? Yes. NRC regulations for radiation exposure: occupational, public, pregnancy or nursing, increased dosimetry in bioassays, and personnel exposure. Occupational: what is the annual dose limit for the body? The whole body is 5 rems. For the lens of the eye, it's 15 rems. And for your skin, it's 50 rems. Where in the NRC are the standards for dose limits mentioned? 10 CFR Part 20. Public: what is the annual dose limit for infrequent exposure? 0.5 rems. Frequent exposure is 0.1 rems. Pregnancy or nursing: what is the dose limit for the fetus? 0.5 rems for 9 months, or it is 0.05 rems per month. Internal dosimetry and bioassays: what is a bioassay? Any employee handling liquid I-131 or any other liquid form of iodine. When must it be performed? Iodine is 2 weeks, 1 millicurie. A bioassay must be obtained within how long when using what? Within 2 weeks, 1 millicurie of iodine. Personnel exposure records: how long are records kept for? For the life of the license. What is contained on the record? Personnel ID, monitor type, name and social security number, birth date, sex, exposure period, radiation quality, current exposure, cumulative, which is the quarter, annual, and total. The units used are millirems. Where must the report be posted? The remote need to be posted where all employees can see it. Where in the NRC regs does this state? 10 CFR Part 20. Medical events: 1 is the definition, 2 is the NRC regulations and reporting notifications. Definition. Alright. A license shall report any event except for an event that results from patient intervention in which the results in one of the following: administered dose differing by plus or minus 20%, wrong radioactive drug, wrong route, wrong individual, wrong mode of treatment, a leaking sealed source. Give a summary of everything that is stated under 10 CFR Part 35, 30, 45 regarding what a medical event is. Do not copy everything verbatim, blah, 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 blah. A license shall report any event resulting from the intervention of a patient or human research study in which the administration byproduct material or radiation from the byproduct material results or will result in unintended permanent functional damage to an organ or physiological systems as determined by a physician. The NRC regulations and reporting. I'm going to try to read these. They're hard to see. The licensee shall notify by telephone no later than 1 calendar day after discovery of the medical event. The next calendar day of the medical event. The licensee shall submit a written report within 15 days after discovery of the medical report or event. The written report must include the licensee's name, the name of the prescribing physician, a brief description of the event, why the event occurred, this effect, if any, on the individual who received the administration, what actions, if any, have been taken or are planned to prevent occurrence, and certification that the licensee notified the individual or the individuals responsible or a guardian, and if not, why not. The report must not contain the individual's name or any other information that could lead to identification of the individual. The licensee shall provide a written description if requested. A licensee shall annotate a copy of the report provided to the NRC with the name of the individual who is the subject of the event and a social security number or other identification number if one has been assigned, or the individual who is subject of the event, and provide a copy of an annotated report to the referring physician if other than the licensee no later than 15 days after the discovery of the event. All facilities monitoring units of measurement. 1 becquerel is equal to 1 dps, which is equal to 60 dpm. 1 curie is equal to 3.7 times 10 to the 10th dps. 2.22 times 10 to the 12th dpm. 1 curie is equal to 3.7 gigabecquerels. 1 becquerel is equal to 2.7 times 10 to the negative 11th curie. Exposure rates. State the formula to convert from CPM to DPM. DPM is equal to the gross CPM minus the background CPM, and then divided over the efficiency. The exposure rate is NL over T squared. The percent efficiency is the means per vial, I can't read that, times 100, something over something times 100, just centigrades per, I can't read that. Alright. Mean is the percent abundance which is given in the problem. What unit surveys and wipes test to be recorded? Those are recorded in DPMs. The definition of contamination area. A contaminated area is more than 2 times background levels, and it is removable. Contamination is anything that we can clean. Well counters. What type of test utilizes a well counter? Wipe test or cisternograms? Does it contain a crystal? Yes. Survey meters. Geiger counters versus QT-Py. If the dose rate exceeds 500 millirads per hour, then you need to use a QT-Py. How often are they calibrated? They are calibrated annually. What test needs to be done prior to using? Battery check in the test source. The wipe test technique. Wear gloves. Wipe in a circular motion about 4.4 inches in diameter for an area of about 100 centimeters squared. Place wipes in the test tubes and measure the radioactivity in a well counter. The net count rate needs to be in units of dpm. If results of a wipe test counts as greater than 22 dpm per centimeter squared is contaminated and the RSO must be notified. NRC regulations, a frequency of the survey and wipes, classification of areas, and posting signs. Frequency of surveys and wipes. How often should the surveys be performed? Daily. And how often should the wipe test be performed? Weekly. But you go by your establishment's protocol. What would the exposure rate need to be for each area? Work. The unrestricted areas access is not restricted below 2 millirems an hour. Anything that exceeds this would be considered restricted and access would need to be controlled. Which rooms would require signs to be posted? That would be hot labs, decay storage, and imaging rooms. List all signs, the exposure rates, and where they would need to be posted in the nuclear medicine department. Caution, radioactive material is quantities exceeding certain radioactive materials 10 millicuries of Tec. Caution, radiation area is greater than 5 millirems an hour at 30 centimeters from the source. Caution, high radiation is greater than 100 millirems an hour at 30 centimeters from the source. Where does the NRC state the sign postings requirements? They are in 10 CFR Part 20. Documentation of survey and results wipe. Interpretation, reporting, and record retention. Interpretation. Wipe tests must be analyzed in what device? A well counter or a Geiger counter? What is the recommended limits for surface contamination in a restricted area or unrestricted area? 2,000 dpm per 1,000 centimeters squared, 100 centimeters squared, for iodine and indium. 20,000 dpm per 100 centimeters squared for gallium, tech, and thallium. 1,000 dpm per 100 centimeters squared for iodine, and 5,000 dpm per 100 centimeters squared for gallium and technetium and thallium. So for the first set, it's unrestricted areas, and then, nope, I got that backwards. Restricted areas contamination levels can be 2,000 dpm per 100 centimeters squared for iodine and indium, or 20,000 dpm per 100 centimeters squared for gallium, technetium, and thallium. And then for the unrestricted areas, it's 1,000 dpm per 100 centimeters squared for iodine, and 5,000 dpm per 100 meters squared for gallium and technetium and thallium. Reporting corrective actions. Surveys RSO notified if triggered level of 0.2 millirems an hour for restricted. Surveys RSO is to be notified if the trigger level of 5 millirems per hour for restricted area and 0.2 millirem per hour for unrestricted is received. The wipe test. The RSO notified if trigger level of 22 per centimeter square of contamination is removed for both areas. Record retention. How long should these records be kept for? Both must be maintained for 3 years. The records must include the date, the results, the instrument used, and the name of the person performing the test. For wipe tests, a map of the area indicating where the samples are taken must be included. Radioactive spills in Appendix 1 of Mettler. Major spills, minor spills, processes for decontamination, and reporting procedures. What classifies a major spill? A major spill is equal to 100 millicuries of TEC, 1 millicurie of iodine, or 10 millicuries of iodine-123. Minor spills. Minor spills involve a small area or a low radiation dose rate, whereas a major spill involves a widespread area or a high radiation dose. The process for decontamination. What is the process for decontamination of a minor spill? What is the process for a major spill? The main difference is you cannot clean up a major spill until the RSO is present. Prevent spread, but do not clean up. Reporting procedures. Do you report a major spill? If so, to who? Do you report a minor spill? If so, to who? Report both to the RSO. For a major spill, a report may be required to the NRC. Radioactive materials, the major categories: inspection of incoming and outgoing materials, storage and disposal of radioactive waste. Inspection of incoming and outgoing materials can be found in Chapter 13 of Mettler. The shipping labels, measurement of exposure rates, measurement of surface contamination, and removable contamination trigger levels. When a package is received, how soon must it be monitored? Within 3 hours of being received or within 3 hours of the next business day? Shipping labels. What is the DOT transport code for radioactive materials? It is Class 7. State the DOT transport groups for radiopharmaceuticals used in nuclear medicine. NucMed radiopharms are within groups 3 and 4. State the 2 types of packages of the radionuclides and explain the differences. Type A is designed to prevent loss of radioactive material, which is transported under normal conditions. Type B is designed for higher radioactive materials with an package to be more accident resistant. State the shipping labels used in nuclear medicine. We use white 1, yellow 2, and yellow 3. Measurement of exposure rates. State the TI index for each respective shipping label used in nuclear medicine. White 1, at 1 meter, no detected radioactivity. Yellow 2, at 1 meter, no more than 1 millirem per hour. Yellow 3, at 1 meter, not more than 10 millirankins per hour. Measurement of surface contamination. State the measurement of the surface contamination for each respective shipping label used in nuclear medicine. White 1, at contact, not more than 0.5 millirankins per hour. Yellow 2, at contact, no more than 50 millirankins per hour. Yellow 3 is at contact, not more than 200 millirankins per hour. The removable contamination limit trigger levels. Any removable contamination in excess of 6600 dpm needs to be reported. Storage. Radiopharmaceuticals, sealed sources, and consequences of improper storage. Radiopharmaceuticals. What is the half-value layer of lead for technetium-99m? 0.2. Syringe shields reduce the exposure levels by a factor of at least 3. Radiopharmaceuticals must be shielded with vial shields or lead bricks to minimize radiation exposure. Sealed sources. I can't read that. Inventory need to be performed how often? Every 6 months. Leak tests and inventory need to be done how often? Results must be reported within how many days? Sealed source results must be reported within 5 days of receiving the test results. What must the report include? The report must describe the equipment involved in the leak, the test results and contamination which resulted from the leaking source, and the corrective actions taken up at the time the report is made. If more than 0.005 microcuries of removable activity is on the wipe sample, the source is said to be leaking. Sealed sources cannot how much activity? Sealed sources cannot exceed 30 millicuries. If the half-life of the sealed source is less than 120 days, the activity cannot exceed 15 millicuries. Consequences of improper storage. What are the potential consequences of improper storage of radioactive materials? The consequences are exposure. Spills include in the minutes at the RSC meeting, which is cited by the state. Disposal of radioactive material is the release to the environment, decay and storage, and transfer to the authorized recipient. The release to the environment. What are the requirements for the sanitary sewage disposal of radioactive materials? Release into the sewer only if material is water soluble. Yearly, a total of not more than 1 curie of NRC licensed or accelerated product materials. An amount of soluble waste that may be discharged depends on the calculation of the amount of radioactive material released into the sewer in 1 month, divided by the average monthly volume of material released into the sewer by the licensee. The exceptions. The total quantity of licensed and other radioactive materials that the licensee releases into the sanitary sewage system in a year does not exceed 5 curies of all other radioactive materials combined. What are the requirements for releasing radioactivities into the atmosphere? Venting. Xenon-131, the amounts used in the nuclear would never reach an allowable limit. How long should the disposal record be maintained for? Records maintained until the NRC terminates each source license. Decay and storage. Half-life is less than 120 days. It can be stored until background level. Longer-lived waste includes thallium-201 and gallium-67, whereas short-lived waste includes TEC. What should the label contain? The label should contain the date and identity of the radionuclide. Transfer to authorized recipient. What procedure must be performed before transferring? When sending dosages back to the radiopharmacy, it must be packaged and labeled according to the DOT requirements, as well as surveyed for exposure rate and wiped. What must you do to the sign on the package before sending it back? Flip the sign to state biohazard. Disposal of pharmaceuticals, expired pharmaceuticals, and partially exposed pharmaceuticals. Okay, so for both of these, they didn't really know in class. The end.